Good morning. As always, I'd like to thank Jay Gates for being with us this morning to interpret. And we're going to start with the numbers. As of this morning, we have 101 cases who have tested positive in Hamilton County. 17 of those individuals are hospitalized, and we have 0 deaths. Our guest today is Greg Kesterman, the interim health commissioner for Hamilton County, who will be giving an update on the spread and what the health department is doing to deal with this ever evolving situation in Hamilton County. But first, a few other items. Our plea to the public this week is, before you go out, ask yourself this question: is it worth it? It's important not to get too comfortable going out. Please stay home. Only go out when absolutely necessary, and keep a 6-foot distance between yourself and other people if you do go out. This is our only way to flatten the curve. We heard from the Emergency Management Agency yesterday on another subject. They have been receiving reports of spam calls to Ohioans from individuals claiming to be from the Ohio EMA and requesting personal protected information such as Social Security numbers. To be clear, the Ohio Emergency Management Agency is not calling Ohioans and asking for their protected personal information. If you receive such a call, it is a scam. Please hang up the phone. Finally, you likely heard the announcement about the City of Cincinnati furloughs yesterday. Our thoughts are with the city as they implement what many local governments across the county will be dealing with, that of the economic shock from COVID-19. The question you're probably asking is, will layoffs and furloughs be necessary throughout Hamilton County? The answer, unfortunately, is that nothing is off the table, but we want to respond in a way that keeps the critical services of the county up and running for our residents. For the city, this came at the worst possible time, being so close to the end of their fiscal year. At the county, we are looking at reductions of approximately $40 million from projected baseline expenditures up to $70 million when compared to budget. So that is a reflection of the reduction in revenue for Hamilton County. The county administrator, Jeff Aludo, has begun discussions with all departments and agencies on budget reduction strategies to keep the county fiscally solvent during this crisis. To that end, we have implemented a hiring freeze. We have placed a moratorium on all new contracts, and we have asked departments to develop plans for absorbing a 20% budget reduction in 2020, which is in line with the state's current request of its own agencies. We have asked all independently elected officials for similar strategies. Unfortunately, the nature of this crisis is that we cannot yet be sure whether these efforts will be sufficient. So we may have to continually revisit as the situation progresses. Layoffs or furloughs will be the last resort for Hamilton County. We are going to have Jeff Aludo here tomorrow to dig in a little bit on the questions of where we are and where we're heading related to the budget. He will also be able to provide an overview of what he's been doing the last couple weeks, reaching out to these elected officials. Lastly, we do still have a primary election going on in Hamilton County. Voting by mail has been extended until April 28th. For most voters, this is the only way to cast a ballot in this election. We have a video from the Board of Elections that will instruct voters in Hamilton County on how to vote by mail. And I believe we've got that video queued up.
Any registered voter in Hamilton County can vote absentee. By mail, it is a 2-step process. A voter sends in an absentee ballot request form, and then once the ballot itself is mailed to the voter, the voted ballot is returned to the board office. To request a ballot, a voter must complete an absentee ballot request form. Here's a sample of Hamilton County's. All required information is highlighted. This application can be found on our website at votehamiltoncountyohio.gov. Once on the home page, scroll down slightly to find the box marked March 17th and click on it. This will pull up a PDF of the application. Alternatively, the voter can call the board office at 513-632-7000 for a request form. The Ohio Secretary of State and others may have similar forms that can be used, or the voter may write the following information on a blank sheet of paper: the voter's name, the current home address, where the ballot should be mailed if it's different than above, the voter's date of birth, one form of ID like the last four of their social, and indicate the voter's ballot selection: Democrat, Republican, Libertarian, or issues only. In addition, this written sheet of paper must include the following statements: I am a qualified elector, and I am requesting a ballot for the March 17th primary. They then sign it and mail it back to the board. They can also drop off the application in the board lobby 8 to 4 Monday through Friday, or in our 24-hour secure drop box. The board uses this information to compile an absentee ballot packet that is mailed to the voter. This contains a ballot specific to the voter's precinct, an instruction sheet, an identification envelope that the voter completes and places their voted ballot inside of and seals, and an outside return envelope with postage paid back to the Board of Elections. If the voted absentee ballot is mailed to the board, it must be postmarked on or before the day before the election, April 27th, 2020, or it can be dropped off at the board office again using the secure drop box. The voter does not need to apply postage. The Board of Elections pays the postage for the return of the ballot. After returning the ballot, the voter can always check the status of their absentee ballot right on our home page. Please visit our website for important election deadlines, including absentee ballots.
All right, very good. Thank you to the Board of Elections for providing that video. We are going to run that more than once to remind people that it's time to vote. It's different this year, but we want to make sure that people understand what they need to do to get that ballot. And now I'd like to invite Greg Kesterman, the Interim Health Commissioner, to the podium for an update on the spread and county efforts to flatten the curve. Thank you.
Good morning, and thank you, Commissioner Dreihaus. I'll run over the numbers real quick one more time, just to reiterate that every day at 2 p.m. these numbers are updated on our website. In the state of Ohio, we now are up to 1,933 cases of confirmed COVID-19. In addition, 475 of those individuals are hospitalized, with 163 in intensive care and 39 deaths statewide. In Hamilton County, we have countywide, including the city of Cincinnati, Norwood, and Springdale, we have 101 cases. In just the jurisdiction served by Hamilton County Public Health, we have 56 residents, with 17 of those hospitalized, and at this time, 0 deaths. I think some good news to report is of those 56 residents in our jurisdictions, 18 of them have recovered. So people do get better from COVID-19, and I think it's really important to remember. I also want to share every day or every Wednesday beginning tomorrow at 2 p.m. we will update on county numbers by zip code. Those numbers are actually up right now. You can visit our website at hcph.org and you can look at the COVID-19 page and you can see cases by zip code for those residents that we have within our jurisdiction. So yesterday we heard from Director Acton and heard a lot about the models. We know that the peak, because we're doing a good job in Ohio, the peak is getting moved back. So they're now predicting that the peak will happen in late April. What that means, though, is schools have officially been closed through May 1st. And the governor actually encouraged us to be prepared for that to be extended beyond. As we do a good job in our keeping Ohioans healthy and from ending up in the hospital, we do prolong this event, but it does mean more of us will survive COVID-19. I want to reiterate my epidemiologists and disease investigators continue on each case that we see in Hamilton County to go out and do an inspection. I shouldn't say go out and do an inspection. They hop on the telephone and speak with the individual that became ill, and we track then everyone that has been associated with that individual. So our team is really busy. Each morning we get started on this work and work late in the day until everyone's been contacted. Simultaneously, our environmental health division has been getting inundated with phone calls regarding businesses and whether or not they have closed and are practicing those safe distancing requirements that we have in place. I want to reiterate, Hamilton County is lucky. Our agency serves 45 jurisdictions, municipalities with their own police departments, and some that use the sheriff's office. When we get a complaint of a business that is not closed, we utilize those jurisdictions. We make a phone call, and the police often will stop out and discuss the issue with the business or with folks that are congregating in a park or on a playground. And often that's all that is needed. So we really greatly appreciate the support that we're receiving from our communities. Um, I want to take a moment then to talk regarding business owners and managers of those business. Many of your employees are scared. This is a difficult time in the state of Ohio and in Hamilton County and the world for that matter. So a day doesn't go by that I don't get a complaint from an employee that's concerned about their health and arguing that their job is not an essential business and why are they being required to go to work. So, it's a very valid point in a time where we at the public health and the hospital systems are actually making a plan to create additional surge capacity hospitals. It's really important to remember your employees. So as you make that plan in your business or as a manager, I really encourage you to keep that in mind. Really take the social distancing thing and take it very seriously so that we can protect your team and we can make your team of staff feel very safe while they're doing their job. Many of us don't have the liberty to stay at home. Public health, for example, most of my team is working in some way, shape, or form, and they still have to do those jobs because they're critical. Obviously, law enforcement, EMS workers, firefighters, hospital workers, all of us have important jobs. But equally important are those folks that work in grocery stores and other places that are considered essential. We need some of those services so that everyone can survive and get through this thing together. So really take that serious. I want to put it back then on each of us individually as citizens. We each also have a requirement to do what's required. So if you show up and you are going to the hardware store today and you walk in and it's crowded and you're feeling like it's crowded, it's really time to go home. Commissioner Dreihaus said, really, really, before you even leave your house, it's time to think about if that trip is important and you should do it. I want to challenge each of us to really take that initiative and make a decision because your actions will protect others. And lastly, I shared last week, and I want to reiterate it. For us as parents, it's really important that your kids are not hanging out with other kids from other households. That will cause the spread of COVID-19. So if the ice cream truck comes down the street, which they're still allowed to do because they're providing food, you need to keep an eye on your kids and make sure they're social distancing in line. If your kids are going to the park, we need to talk to our kids ahead of time about not playing on the playground. I'm getting reports from some of our communities that they're breaking up groups of kids on the playgrounds fairly frequently. And so it's really our responsibility as parents to help make sure our kids, regardless of if they're 6 or 18, that they understand the importance and the role that they play with regards to preventing COVID-19 from spreading. All of these steps will our hospital systems have the needed capacity when it gets bad in April. So I greatly appreciate your support and help on this. The last thing I want to share is that our website, hcph.org, has a bunch of valuable information, as well as the state's website, coronavirus.ohio.gov. Please feel free also to call the state's 1-800 number hotline, which is 1-833-427-5634. Thank you.
Thanks, Greg. Before we go to questions, I want to answer a question that was brought to our attention yesterday. One of the reporters asked about Kroger specifically and about what Kroger is doing. I shared an anecdotal story about Home Depot, a hardware store, where they've got X's on the floor to distance people as they go in, as they check out. But the question was specific to Kroger. So I reached out to Kroger. And I'm going to read what they sent to me. First of all, they said that protecting their workers is a top priority. And they talked about this social distancing question. In the past few weeks, Kroger placed signage throughout the store reminding customers of the CDC guidance to remain 6 feet apart. In addition, decals were placed at the check-in lanes to demonstrate where customers should stand when queuing. Once an hour, 2 separate messages remind customers about the CDC guidelines. It plays over the in-store loudspeaker. An easy guide to remember: try to keep 2 cart lengths between you and your fellow shoppers or store associates. So that is directly from Kroger. I will tell you that I work about a half a block from a Kroger store. And so I took a little field trip over to Kroger just to get a better understanding. And sure enough, there are decals on the floors. They are 6 feet apart. The associates were obviously trying to distance. I think the customers were less deliberate about that, but I think we were queuing off one another and kind of stepping away from one another. And so, as the health commissioner said, we can and we should ask for employers and employees to do what they need to do to keep each other safe and to keep customers safe. But a lot of this is on us. As we go into a space, we are the ones that need to keep our distance. We are the ones that need to keep ourselves and other people safe. This is on all of us. We're in it together, and we are relying on one another to practice the social distancing and stay at home when we can. And so I do just want to mention, and I'm just piggybacking off of you, Greg, that we all bear responsibility to do this well and to make sure our kids are also doing what we need to do to keep ourselves and each other safe. Um, Bridget, I think with that we'll go ahead and go to questions.
Our first question for today.
The podium. You mentioned Cincinnati announced furloughs yesterday as the city has 3 months to close a budget gap for this year and draft next year's budget. The county's budget is on a calendar year, so do you take immediate budget measures or do you wait a few weeks or months? What happens going forward?
So feedback there. So we are looking at the situation now. Obviously, we have to do that. And Jeff Aludo and other electeds have been working on this for a number of weeks, trying to define strategies that work department to department. You are correct in saying that the calendar year for the county is different. So we're near the beginning of our calendar year as opposed to what the city is looking at. Our income streams are also different. So while they rely very heavily on the income tax, we rely heavily on the sales tax and the property tax, in addition to fees and some other sources of revenue. So Jeff Aludo is going to outline all of that tomorrow. He's the one that has been reaching out to the department heads and the other elected officials throughout the county to get a work plan from all of them so that we can move forward on a common strategy. More to come, really. More to come tomorrow on that.
Thanks, Jay. I think Jay had a second question for Greg Esserman.
Yes, for Greg on social distancing, I was taking a drive last night and I saw three moms with strollers taking a walk side by side. And I thought the exercise is good, but you've got the spacing all wrong. Is the social distancing recommendation like most other things? People think you're talking to someone else and not them. And how do you get through to these people that it means everyone, including you?
Thank you for the question. And it's a very great question. The rule is if you're in the same household, if you're living together as a household, you don't have to social distance. So if I'm going somewhere with my wife or my kids, we can all hang out real close together because we're doing so all the time. But if you're taking a walk with some neighbors, that's awesome, but leave 6 feet. That 6 foot rule applies to anyone not as part of your household when we're in business settings and wherever we may be. Try the best you can to leave that 6 feet distance and that will keep you safe. Otherwise, if one household gets sick and they don't know they have symptoms yet and are spreading COVID-19, they're making another household get sick at the same time. And that's exactly why we're doing social distancing.
Thank you so much. I think our next question comes from Marielle Carbone from WCPL.
Yes, and mine are mostly for, well, actually, I guess all for Commissioner Dreihaus. I guess to start first, you had mentioned the way you guys receive the funding and, your tax is obviously a little bit different from the city, but between the sales tax, the property tax, the hotel and lodging taxes, where are you guys feeling the biggest impact as far as loss of revenue?
I think the sales tax is going to be a huge hit because sales tax revenues are going to be so far down related to businesses closing, and people frankly aren't buying things like they were before. I think what you're going to hear from Jeff tomorrow is that we, for the first time in a number of years, were feeling pretty good about our budget year. Remember, we were going to have some increased revenues come April of 2020. So here we are. When the Union Terminal tax rolled off, then that same quarter was going to be repurposed for basic services in the county. So we were positioning to be in a very stable place, shore things up, and here we are. And so the timing could not have been worse for us. But I think we're going to see a significant hit on sales tax. We are also, the hotel tax is a separate fund, it's a restricted fund. But the hit on that fund is tremendous because our room nights are. I think they're 10% and lower right now. So that's a huge hit. Also, our parking revenues are down. So we're taking it in a bunch of different funds. But I think you'll hear from Jeff tomorrow. He'll talk more about the general fund, which is what we use to provide basic services through the courts, through the jail, through other services through the county.
And actually,
It
you kind of
appears
brought up the
Mariel has another.
union sales tax there. Um, I guess, are you guys, is it a good thing though that at least you guys kept on that 25 or that, that 25% there? Because if you didn't have that, I mean, that would be even more of a loss of revenue. So is that still a good thing that you guys brought that on to continue with the sales tax? Or I guess, how does that kind of play into everything?
The point of it was to have it. Remember, it's 0.25 of a penny, so a quarter of a penny it was the formula through which we would get the sales tax. But an increase to lesser is not great, right? So, yeah, it's good news, I guess, that what we are receiving from the sales tax is a little bit higher, and it's marginal, by the way. But with the reduction in the sales tax overall, I guess we'll see how that plays out, and Jeff will elaborate on that tomorrow. But it's going to be tough. It's going to be tough, and we're going to hear from Jeff as to how those conversations are going. Remember, too, in Hamilton County, that we have departments that are under the county, but then we also have elected officials running departments throughout the county. Think about the recorder, the treasurer, the sheriff. So when you think through that and the complexity of that, I think that's what you're going to hear from the administrator tomorrow. We are all really going to be challenged moving forward here.
I have two more questions if I'm okay to keep going. The CARE Act, I know that the city is not getting that direct funding from that passing. Is the county getting any direct funding, or are counties treated differently under that?
Again, Jeff will elaborate on this tomorrow, but my understanding is that we are getting some additional funding, but from what we know right now, that funding is relative to the
Slowdown or a change in the services that they get from the county every day?
Well, I think they've already seen a change in the way we're administering services because we're trying to do as much as we can online or over the phone. And so there already has been a change. I'm not sure slowdown would capture it because it's just a matter of instead of coming to the building in person, you are acquiring whatever you need or the service that you need online or by phone. So there has been a shift, and I think that shift will continue as long as we have to do this. But I think the county is open for business. I have not heard any anecdotal stories about how people are unable to access what they need from the county right now. And so the one other thing I want to note is that there is one point in this building. The building is closed to the public for the safety of the public and the safety of those of us that work in the building. But there is one location down on the first floor where if you need a document from planning and development, perhaps, that is larger than life and it can't be emailed over, then you can make an appointment with somebody that from that department, and they will literally run that document down to the desk on the first floor, and you can get that document.
Neil? I think our next question comes from John London with Channel 5.
Denise, basically about with and the strollers, because I've seen much worse out there in the community, and I'm wondering if any of you think that the social distancing rules need to be tightened more and enforced in a more authoritative way at grocery and at parks and at places where people gather as we head into April. And does the county have any authority to simply close parks and to order business to limit the number of customers who come in and out?
Hey, John, so you were breaking up a little bit, but I'm going to reinterpret your question. So, and I think it's for Greg Kesterman. So I believe your question is, as we go through this and we do see a number of customers in a store or something happening where they are not practicing social distancing, what can be done then? So I'm going to move out of the way here.
Thank you for the question. As I mentioned, we have been working very closely with the 45 communities in which we serve, and the police departments in each of those communities have been very effective in merely going and talking with either the business owner or the group of individuals that are congregating at a park and are able to gain compliance almost always. Yesterday or 2 days ago, I had a complaint from one of our jurisdictions that they had talked to a hair styling shop that sold product, and they were remaining open and were trying to claim that they had essential product that they had to continue to sell. In those instances, which are rare because we have such good compliance when we make the reach out, but in those instances, my office will issue an order, and then that order is enforced by the police department. So I sent the order to the police. The police officer went to the shop, posted the order on the door, and asked the facility to close. The facility wasn't happy, but they complied at that time. Um, there are a bunch of essential services listed in the governor's order, and there is gray area in that order. And as Director Acton said, we are doing the best we can to stop that social distancing from having violations. However, we're only going to get 80%, and 80% is what we're working to try and increase and improve. But it does take time, and it does take legal opinions to work through some of those more difficult scenarios. But I can assure you that with each call, my team reaches out to the business. We try and troubleshoot. If an inspection is necessary, my team goes out and does that inspection. And then with the coordination and cooperation with our jurisdictions, we're able to gain compliance.
Thank you. John, did you have another question that you'd like to ask?
For Denise, I'm wondering, the city put 1,700 on temporary leave yesterday. I'm wondering if the county, if it does take action with regard to furloughs, et cetera, will that same form? In other words, if you do lay off with the temporary leave, or you look at a permanent.
Going to reinterpret that one too. So I think you're asking what's the strategy for the county. We saw what happened at the city with the 1,700 employees being furloughed. What are we going to do? I think is your question. And so Jeff Aluda is going to elaborate a little bit on that tomorrow as to what he's hearing from the departments throughout the county. We're not quite there yet. We're getting there quickly. But I think we have to look at all the options here and get it. There are two things really. The one question is, what kind of reduction in revenue do we anticipate? And so there's modeling going on, particularly related to sales tax, to see what the economic hit is going to look like. And then you say to yourself, all right, if that's what we anticipate, what does that mean for the workforce and how do we deal with it? And so that's the information that is being collected right now. I cannot answer the question as to what that strategy looks like at this moment in time, but I think we will, within the next few days, start to hone in on that strategy.
And from John London, he types, Denise, what have you learned from the stimulus impact from DC?
I did talk about that just a minute ago, about our ability to use those dollars to kind of stem the tide here, as we talk about what strategies we're going to have to employ with, employees, whether it's furloughs or something else. And so, if we could get some flexibility in those dollars, that would be very helpful. But right now, my understanding is they are all related to the COVID-19 response. It's helpful, and I don't want to disparage what the federal government has done by way of some relief, because it's very helpful, because we have had a response, obviously, to COVID-19, and we can utilize those dollars throughout the county. But we're trying to get a better understanding of what the impact then is to the reduction in revenue for the workforce and for the services that we provide. So we're trying to figure all that out.
Another question from Chris Wederick from the Business Courier.
Denise, do you have any hopes for a third or a fourth COVID federal bill? I mean, the savings the city is accomplishing by laying off 1,700 people is only $3 million. I assume it will be similarly sparse for the county. Do the feds need to step up and put a kind of a more massive package to help cities and counties?
I do think there's going to be another package. I mean, I'm hearing that from those that are on these calls. And by the way, our partners in this have primarily been Senator Brown and Senator Portman. I'm extremely grateful that they have been so accessible to us as they try to understand, what's going on the ground. And so when we have these calls, they're 3 times a week. We've got their chiefs of staff on the line talking about what we know, what they need to respond to, what they're hearing. And so I do think we're hearing from the others that there's likely to be another package. The question becomes how much and what can we apply it to? Some of the questions we have now. So I do think there's more coming. But again, I think if we respond with some of those dollars to try to continue to maintain the services of the county, I think that would be useful. And it's not going to be all of it. Of course, we're still going to have to take action at the county. We know that, just like the city did. But it's just a matter of degree, and we're trying to figure that out.
Scott Wortman from the Inquirer has one question for Greg and one question for you, Commissioner.
All right, well, I'll stay for a moment.
We'll start with the Commissioner's question.
Denise, do you have any idea what the sales tax, taking the hit that it will, how will you guys pay the debt on the stadium? I understand there is some balance. I don't know what that is. How long can you pay the debt on the stadium before you have to dip into general fund?
Well, that again, we'll be talking about this tomorrow with Jeff. We do have a balance in the stadium fund. And so it'll be a matter of how long we are in this with reduced revenues and how long it's going to take to get out of it. And I've heard Jeff talk about it by way of a U curve. And so, it's not going to be a V curve. It's going to be a U curve where we get into it slowly and then we slowly come out. And so we are modeling all of that with our budget office to try to figure out what that trend looks like. I mean, Greg just talked about this. This is hard to measure. And so we are doing our best to measure and trying to use the information we have to predict. But Jeff will talk about that U curve tomorrow. Oh, and next question.
Do you have any idea on the numbers regarding how many complaints you've gotten on businesses and how many have you had? Was it just that one that you had to order closed, or how many total have you had to order closed?
Have an exact number, and as I mentioned, I have a team of actually 13 individuals that are manning the phones in our environmental health division, and I can share that when the order first came out in the first few days, we were getting well over 100 calls. If I had to guess, it would be in the neighborhood of 200 calls. And each one of those calls initiates a response. And, I'm trying to keep my team safe as well. So the first step that we do is a phone call to the business and a discussion with the business, and often ask of the business to put something in writing about why they're essential. And then we take a hard look at that, working with the prosecuting attorney that is responsible for our office, and we make a decision on whether or not they should be considered an essential business under that order. Commissioner Dreihaus has done a wonderful job of communicating the need for a statewide response to determining which businesses are essential and which are not. So until that happens, my team is also reaching out to the other jurisdictions. Hamilton County has a total of 4 health departments, myself, the city of Cincinnati, Norwood, and Springdale. I'm trying the best I can to align with what they're doing, as well as looking to Butler County, Claremont County, Warren County, and the other big counties to make sure that we're all handling cases similar, and trying to make it as fair across the board as possible. Doesn't work perfect every time. And as I mentioned earlier in the press conference, our goal is let's focus on the businesses where we know there's a significant number of people and will have the greatest impact. And then we keep on working as we go along. Yesterday, I was told that our calls were less than they were the day before, and we continue to see less calls. I encourage anyone with a concern, you can either call our environmental health division directly at 946-7847, or I'd also encourage, we're promoting online businesses at this point. You can visit our website at hcph.org and use either our complaint form or question form and share information. We're getting those as well, and they're very helpful, and they help us focus our energy, and they help us reach out to our communities to help to bring enforcement.
Thank you. Our next question is for Commissioner Dreihaus. This is from David Winter with Local 12.
Hi, Denise, and I'm sorry. I know that you want to wait till tomorrow to address a lot of the questions about the potential furloughs and so forth. But I think with yesterday's announcement by the city, a lot of county workers are concerned. What can you say other than, we'll have to wait until tomorrow to hear from Jeff? What would you say to the first of all, how many workers do we have? Are we talking about that work for the county? How many thousands? And what would you say to them today, other than we'll address this tomorrow? And then I have one follow-up question.
Look, it's not only about tomorrow, it's how are we going to approach a situation where we've got significant reduction in revenue, and how do we respond to that and try to keep basic services operating and do the best we can for our employees. And so that's the question. And so, we're going to hear from Jeff Aludo by way of he's going to dig in a little bit more and give us some context for the kind of modeling that they're doing. It's hard to predict because there is a lag between the reporting of the sales tax and today. And so that's why it's so complicated. I think what the employees expect of us and the administrator is to reach out to the electeds, to the department heads. They know best what's going on in those departments, and we are going to rely on their expertise to inform the decision. And so I'm not ready to talk about what that strategy looks like in the specific because we don't have that yet. We've reached out, all that information is being accumulated, but I'm not in a position today to tell you what the county is going to do countywide because we're still working through that strategy related to the models and the information we're getting from the department. So that is what it is. And so we know we don't have much time to come up with a strategy. Been working on it for weeks. I think Jeff will give the context that's necessary and then help to provide some kind of timing as far as when the employees will be impacted. Look, our employees are impacted. Many of them are staying at home right now. Their lives have been disrupted. They're trying to do their best work, and I applaud them for that because so many of us have had to adjust. Everybody's had to adjust. But I want to say that we are going to be as responsible and responsive to them as possible as we move through this. Can I back up for 1 second? Because Greg offered a number we've talked about this before, about this idea that business owners and employees have some confusion as to whether or not a business should be open or not, or whether or not it's an essential business. And I have given out that number before and felt pretty guilty about it because the health department then became overwhelmed with calls. I know people need information, but that was a bit of a challenge as they trace people that have tested positive for COVID-19. So, Greg, thank you for relieving me of my guilt because Greg just gave you the number to call if you are an employee or an employer to get some clarity as much as we can with the stay at home order. Remember, the stay at home order was enacted by the Ohio Commissioner of Health, and I applaud the work and the governor's work on this. But now we have to contend with a stay at home order that's not crystal clear all the time. And so it's been left to the locals to not only interpret but enforce. So we don't yet have a statewide hotline. There is something through the chamber and for I think primarily the business owners, but it is not all that responsive, especially to the employees. So, Greg, what's the number again? 946 7847. If you have any calls or, I'm sorry, questions about businesses. Thank you for relieving me of my guilt over the last few days.
We're going back to David Winter for a follow-up question from Local 12.
Yeah, so Denise, and again, I apologize for pressing you on this, but so are you saying to the employees, sit tight, you'll know within the next few days or a couple of weeks? What would you say?
Saying to the employees that we have been doing the work over the last few weeks to try to figure out the strategy as we look at a reduction in revenue and our workforce. And so right now, given what the governor did a few weeks ago, a couple of weeks ago, related to the April 3rd deadline for schools. So what we did was say to our employees, we are going to reclassify if you need time off to be home with your kids. If you've got a medical situation related to COVID-19, stay home. We don't want you to come in. We want you to try to work from home. If you can't work from home, then we've got what's called like an administrative emergency leave for those employees. So that's in place until April 3rd. So you can see these timelines lining up. And so as of April 3rd, which is quickly approaching, we need to have a different strategy than moving forward. So that's what I'm saying. We've already got something in place right now. We are going to need to adjust as this continues, and that's what we're going to do. And so I'm not making any promises by way of timeline because I don't have that information. But what I can tell you is that we've been working on it. We've got something in place right now for the employees, and we are going to quickly have to adjust as we move through this.
We have a follow-up question from Jay Hanselman of WVXU.
This question would be for Denise. The federal government, state government, City of Cincinnati have all delayed the filing deadline for income taxes. Has there been any discussion or thought that the county could delay the next round of property tax payments, which I assume would be due in June or July? And is that something the commission can do, or does that rely on elected leaders, county auditor, county treasurer to make that decision?
So we have discussed it. It, like everything else, is on the table. And yes, you're right. There are other elected officials that have to get involved, and I believe petition to the tax commissioner in Columbus in order to make that happen. So we have had conversations about that.
Okay. We have a question from Mariel Carbone with WCPO.
Oh, sorry. I was just responding to the thing you put in the chat about the numbers for the county employees. Are the 1,400 included in that 4,400 that you wrote in the chat? Or there's,
Our total county employees.
okay, that was it. Thank you.
Okay. It doesn't appear that we have any last minute questions.
Okay, I'm going to offer Greg to come forward in a minute, but I do want to highlight something that you said, that the governor has said, that Dr. Acton has said, and we have said over the last couple of weeks. The whole idea of everything we've been talking about, which is the washing your hands, stay at home, practice social distancing. All of it is to flatten the curve and also push out the top of the curve. And you just mentioned that today, Commissioner. And so I want to remind people how important it is that we all take what we can do to make sure both of those things happen. Because what's happened in the meantime is that we have Battelle now being able to sanitize thousands and thousands of masks for our frontline workers. What we also know is that there are companies with 3D printers here in Hamilton County that have stepped up and said, how can I help? And give me the formula or the diagram or whatever they need to create 3D masks for our frontline workers. You know, what we know is that we are preparing for additional capacity for people that need medical treatment. That is also taking place. And because we have flattened and delayed the peak of this curve, all of those things have been able to happen. With a sharp increase quickly, none of that happens. And so the work that has already been accomplished is very important. And as we move through this, it will continue to be important. And so we're buying time. We're trying to reduce the number of people that get infected, but we're also trying to buy time so that some of these other things can be in place by the time we get to the top of the curve. So Greg, I'm going to leave the last word to you. I know you can elaborate that on a little bit from a medical perspective, but I do want to say that what you're doing is so important. So I know it's frustrating. I think a lot of parents with school-age children were frustrated yesterday at the delay that's now in place for the school kids going back to school. But you know what we're doing is, from all accounts, working in the state of Ohio and in Hamilton County, and I think it's really important to keep that in mind.
Thank you, Commissioner. It is absolutely important that we take these steps now. We are lucky, our hospital systems, we have great hospital systems in Hamilton County, and having that infrastructure is going to be such an asset as we start to see cases increase. It's not a matter of if they increase, we know they are coming. We're seeing the cases go up daily in Ohio. And as Commissioner Dreihaus just indicated, the steps we're taking now are helping to build capacity. We're seeing our hospitals today emptier than they were this time last year. We know we still have flu cases, and we know we still have people needing those emergency services at the hospital. But by reducing some of those elective surgeries and things that we can put off until later, we're creating that capacity. So when we start to see the top of that flattened curve here in Hamilton County, our systems are ready for it. We heard the governor yesterday talk about building additional capacity, and some of those hospital systems are already in those dialogues and figuring out what next steps need to happen. All of this is great to ensuring that our frontline personnel are protected when we start to see the spike here in Hamilton County. I want to close on the note that I really want you to focus on yourself and making sure that you're doing everything within your power and your family's power to create an environment of social distancing. As we go outside, as we are meeting our friends, remember 6 feet apart. If you're going to go walking with them with the strollers, 6 feet apart will help keep you safe and your family safe. So I think it's super important, and I appreciate everyone's work to making Hamilton County the safest spot in Ohio.